I'm Matt Willis, Public Health Officer for Marin County with the COVID-19 update for November 11th. Today, I'm going to summarize the most important steps you can take to have safe holiday gatherings this year. These are active conversations in my own family, and it's not totally cut and dried, so I'm going to share how we're approaching these questions in our own household. One of the most important goals for us as a family is to protect those who are most vulnerable, and for us, that's the grandparents. We have family members across generations who will be coming together, and we want to keep everyone safe. Nationally, more than 2,000 people are still dying every week from COVID. In Marin, more than 90% of those hospitalized who have died from COVID in the past 6 months have been above age 65. So it's still very important to take pandemic precautions we've all learned. The message to those coming into our household is to get the fall booster now. That goes for everyone over age 5. We know the booster vaccine is working. In Marin, the risk of hospitalization among people who have received the new booster is 5 times lower than for those who haven't. And we've had no deaths among people who have received the fall booster. Another challenge this year to acknowledge is flu. Our wastewater and case data show we're seeing a rapid rise in flu in Marin County. Nationally, this is the earliest spike in flu cases in 13 years. And like COVID, over 90% of those who are hospitalized or who die from flu infection are over age 65. Fortunately, both flu and COVID are vaccine preventable. This year's flu vaccine is a good match for the current strain and is available at the same time as the updated flu shot. Now onto RSV. Again, our local data is showing a rapid rise in RSV, or respiratory syncytial virus, which I covered in a recent video. The most important points about RSV are that it tends to be mild for most people, but can cause serious respiratory illness in young children. There's no vaccine or treatment, and that it's easily transmitted through touch, which means hand washing and cleaning surfaces is particularly important. So what does this all boil down to in our household? Again, our number one goal is to protect our loved ones. The most important message for our crew is that everyone over age 5 planning to attend should be up to date with the COVID and flu shot. My mother-in-law just got her flu shot today, and that gives us all some peace of mind for a safe gathering. The other way we'll protect our loved ones is to prevent infection during the few days leading up to the gathering. I'm asking my healthy family members who may not normally mask up to wear a mask in indoor public settings starting 4 days before the event, and to double down on hand washing frequently for at least 20 seconds with soap and water. Finally, on the day of the event, here's what we'll do. We'll rapid test everyone before we gather indoors together. We know ventilation is a powerful tool, and we'll try to hold as much of the gathering as we can outside on the patio, and keep indoor spaces as ventilated as possible and use our indoor air filters. And of course, everyone will wash their hands. And finally, and it could be a heartbreaker, but we're asking people if they do have symptoms to stay home, because it's a simple and effective way to not spread illness at a holiday dinner. With those measures, vaccinations against flu and COVID, masking and hand washing, testing and ventilation, staying home when you're sick, our friends and family, spanning 3 generations, will feel safe when we're together. I hope we can all follow these steps as a community, so that when we're together, we can focus on how good it feels to be together with our loved ones. Thank you for doing your part.